Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Yemi Famuyiwa. She is a fertility specialist and founder of the Montgomery Fertility Center. Today's Kevin MD article is The Impact of Sleep on Fertility, Why Rest Matters for Reproductive Health. Yemi, welcome back
Absolutely.
to the show.
Thank you. Thank you for having me.
So, tell us what your latest Kevin MD article is about.
Well, I'm always looking for ways to help my patients. And this came about when I had a patient who complained of severe sleep, like she can't get any sleep. And I had to brainstorm ways to help her do some research. I think she's on sleep medications too. She's with her internist. And I said, you know what? Let's look at what sleep is doing to fertility. How's it affecting patients? And what can I dig up and how can I share it with my patients so that they have something actionable?
So, what are some of the connections between sleep and fertility?
Well, interesting. There are several articles that have come out. I think initially the exact mechanism is still being worked out, but observational studies always leads to experimental studies. And they found out in sleep observation that there's a huge Chinese database where they looked at almost 3,000 patients, a quarter of whom, we're talking about fertility patients, a quarter of these patients reported sleep disorder, sleep disruption. So patients who have infertility have high sleep disturbance. So when you look at sleep disorder like sleep apnea, what else can do with abnormal sleep? So that's really important for patients.
Now you talk a little bit about the physiology, about how
Uh-huh.
sleep disturbances affects
Uh-huh. Uh-huh.
fertility. So go more into the physiology. How does that
Uh-huh.
affect regulating fertility?
So when you have sleep disruption, it affects the hypopituitary, it affects your GnRH.
Hmm.
It affects your hypothalamic, hypogonadotropic. You can get hypogonadotropic hypogonadism if you have sleep disorder. So it has to do with your hypothalamus, right? If you have sleep disruption, then you have disruption of your GnRH going to your pituitary, affecting the production of FSH and LH.
Hmm.
So if you have disruption in your sleep parameters, then what we found out is that you may have abnormal production of testosterone in men. With abnormal sleep parameters, it could affect also your prolactin production. All those things indirectly affect the function of the eggs and the function of the sperm as well, right? So, and when you have disrupted sleep, we found that patients have what is called stress. So, when you look at patients who have oxidative stress, if you have high oxidative stress, then it starts to affect your egg and your sperm,
Mm.
right? So, the lack of sleep leads to the stress, and increased stress disrupts both the function of the egg and the sperm. So we also look at patients who have, there were studies where they looked at, I think in the Chinese population, if you have too few sleep and too much sleep, you have a U-shaped curve of the function of fertility. Both the fecundability, the ability to conceive. And then they also went a little deeper. They looked at sperm count,
Hmm.
sperm motility, sperm morphology. The only thing that sleep did not disrupt was the semen volume,
Mm.
but it affected sperm concentration. But then semen volume is not dependent on the testes, really. It's dependent on the sperm being produced from the testis itself. So it affected the species with what's going on with testes.
So how do you ask about sleep when you see patients in your evaluation in the fertility clinic?
Yeah. So what I usually do is just kind of talking to patients to see what bothers them the most. What is bothering them? So when you start to talk to patient about what bothers them, you start hearing patients talk about, oh, I can't get any sleep. So when people start complaining about um, not being able to get enough sleep, so then I start looking into what, you look at you ask them questions. How are you getting sleep? What's going on? Do you need a sleep medication to get any sleep? So that's when we start to get indication that there may be a problem. So now they call them sleep specialists out there.
Hmm.
So if I have a patient who's complaining a lot, I refer them to some of these sleep doctors who can hopefully help them figure out what to straighten out their sleep going forward.
Now, in terms of medication to help
Yes.
people sleep, are
Hmm.
there any specific medications that would be safer than others, especially when one considers fertility?
So what I have done is I don't really go into the exact medications per se. What I try to do is if I start to catch some problem with sleep, I like to refer them to sleep doctors. There
Hmm.
are some doctors who specialize in sleep function. So my job is to catch something in the very beginning and then refer those patients out to someone who specializes in sleep pathology.
Now, let's say someone comes to you and you
Mm.
identify that that patient doesn't get the best sleep.
Right.
How soon after correcting the sleep can the reproductive function resolve itself? Is it over a period of time? Is it relatively quickly? How fast are the effects after correcting someone's sleep patterns?
I think for most patients, if they correct their sleep, I think that if they correct their sleep pattern, they get almost instantaneous benefit. It's patients who have really chronic sleep deprivation,
Hmm.
where just me advising them to say, develop some good sleep etiquettes, like start programming your body by going to bed at the same time, by dimming your lights, by avoiding, blue lights. So you can do that, do little things to kind of help yourself establish a routine. But if the problem is ongoing and is severe, then I usually prefer to refer them to someone who is a sleep specialist.
And as you mentioned earlier, sleep affects fertility, both, of course, with both men and women as well.
Exactly. Yes. There's a U-shaped curve. If you have too much sleep or not enough sleep, both in men and in women, there's the U-shaped curve. So that if they have too little sleep or too much sleep, you have that U-shaped curve in fertility. And that is seen with both sperm and with female fertility.
And just to be clear with our definitions, how much sleep is too much and how much
Uh-huh.
sleep is too
Uh-huh.
little.
Okay, so I think most of the studies they looked at anywhere from 7 to 8 hours is a very good, nice sandwich time. The studies I looked at, once sleep starts to exceed 9 hours or 6 hours and less, is when you see that U-shaped curve where fertility and fecundity decreases in both men and women.
And how common is it that you unveil a problem with sleep patterns just for someone coming to your clinic for a fertility issue?
For most people, it's not very common. It's not very common, but you can check if they need any sleep or so. But most of the studies that I've looked at, if the sleep hygiene, if you will, if I think 24% of people with a infertility have abnormal sleep patterns. So I think it's not very common. I would say 24% of patients. But when you do see them, I think most people having the minimal intervention would help. But if the sleep deprivation is severe, then I prefer to refer them to someone who can now use more medication or a sleep doctor, if you will, who can help them better.
Now, in your article, you specifically call out obstructive sleep apnea as
Yes.
affecting
Yeah.
reproductive health. So talk specifically about
So
obstructive sleep apnea.
So obstructive sleep apnea, you have sleep disruption, right? So you have patients who have disrupted sleep pattern. The problem with obstetric sleep apnea is when you combine it, one of the co-founders is those patients also are subject to the patients are subject to obesity,
Hmm.
um, with diabetes, type 2 diabetes and high blood pressure. So if you have patients who have obstetric sleep apnea, you have a higher incidence of infertility in those patients. The question is, what is the cause of
Hmm.
the infertility? Is it because of the obstructive sleep apnea? Is it because of PCO that you see in both? Is it because of type 2 diabetes that you see in both? Or is it because of high blood pressure? So there are certainly co-founders in there that could give you a bad outcome with both fertility and sleep intervention, sleep disruption, if you will.
We're talking to Yemi Famuyiwa. She's a fertility specialist and she's the founder of the Montgomery Fertility Center. Today's Kevin MD article is The Impact of Sleep on Fertility, Why Rest Matters for Reproductive Health. Yemi, as always, let's end with some take home messages that you want to share with the Kevin MD audience.
I think the take home message is pay attention to your sleep hygiene. You might be surprised that the reason your ART treatment is not working or you're not getting pregnant on your own is there may be a profound issue with sleep. And most people don't think of sleep. Until I started writing this, I didn't even know sleep could be considered a fertility medication, if you
Mm.
will. So I think people need to pay more attention to the emerging field of sleep as a medicine, especially when it comes to fertility.
Yemi, as always, thank you so much for sharing your perspective and insight. And thanks again for coming back on the show.
Thank you so much.